it's almost like exercise becomes a form of exposure therapy where you, in essence, you put the individual in a situation where those symptoms are increased, and yet they realize, well, my heart rate is elevated, but I'm not anxious.
One of the beauties of exercise is the side effect profile compared to something like pharmacology, which obviously there's different medications with different side effects, but generally speaking, it's a lot more benign. The side effects are positive. Okay, you're doing it for your mental health, but you're going to get the physical health benefits.
As the intensity of exercise increased, people felt progressively less pleasant, and at some point would even start to feel unpleasant during the exercise.
Exercise is a best buy, but a tough sell. And despite all these wonderful benefits of it, we still, like you said, are struggling to get people to do it or to adhere to it.
Basically, we haven't moved the needle, right? People are no more active today than they were when we started doing this. Even if endorphins are elevated, it may not be associated with the reduction in anxiety. So does that mean that the endorphins didn't cause the anxiety reduction? Maybe, maybe not.
Hello, everybody, and welcome back to the show. Today we are joined by Professor Steve Petruzzello to discuss all things exercise for anxiety. Steve is a pioneer in the field of exercise for mental health, publishing seminal meta-analyses in the field that have been cited thousands of times. Steve leads the Exercise Psychophysiology Lab at the University of Illinois. He's a fellow of the National Academy of Kinesiology and teaches the next generation of clinicians on the importance of exercise in mental health. In today's episode, we discuss how exercise can be used in conjunction with therapy and medication to help your anxiety, why and when exercise can actually decrease your mood, the neurobiological mechanisms behind the effects of exercise for anxiety, and much, much more. If you enjoyed today's episode, or indeed if you enjoy any of the other episodes of the Mental Wellbeing College, we would be so grateful if you would hit subscribe, follow, or to share the podcast with someone you love. Our mission here at the Mental Wellbeing College is to provide a free, accessible resource based on evidence-based strategies so that you can take steps to improving your mental well-being. And you sharing, subscribing, and or following helps us to hit that mission and to impact people the world over. Before we dive into today's episode of the Mental Wellbeing College, an important disclaimer. We do dive into the weeds of mental health, which means that at times we discuss sensitive topics like suicide, self-harm, and substance abuse. If hearing such discussion does bring up distress for you, please do seek the psychological and professional treatment that you need. The content covered in this episode is not intended as a substitute for professional mental health treatment. All right, Dr. Steve Petruzzello, welcome to the Mental Wellbeing College.
Glad to be here. Thank you for the invitation.
It's so fantastic to have you on. We're going to be talking about a topic that's very close to my heart, exercise and anxiety. I've had the privilege as a personal trainer to be able to see many clients go through an awesome journey, not just physically, but mentally, including with their own levels of anxiety through exercise. And also just personally as well, in my own 20s, using exercise as a tool, not just for my own physical, but mental health as well. So to be able to deep dive into this with you, go through the evidence is a really cool opportunity that I'm looking forward to. Let's dive into some of the evidence initially as well. So obviously, Steve, your research is on exercise for anxiety. So tell us a little bit about why or whether exercise can reduce anxiety.
So the answer to that is yes. Most of the research that I have been involved in and have read and examined, anxiety is anxiety disorders are the number one mental health problem that adults around the world experience. And yet, somewhat ironically, when we look at the research on physical activity and exercise and anxiety, it's actually not been done as much in individuals who are living with anxiety, either symptoms or, I hate to say full blown, or an anxiety disorder of some sort. Having said that, and to follow that up, so depression is kind of the next most frequent mental health disorder or mental illness, and it is the most studied from an exercise perspective. But if we think about the anxiety work, there have been a number of, and there are more coming down the pipe all the time, good studies that have been done with individuals who have either elevated symptoms of anxiety and or anxiety disorders of various types. And the research is pretty convincing. Those who engage in exercise typically show reductions in those symptoms. I don't like the word cure, because I don't think we're ever really cured from a disease or an illness, but there certainly is a remission, right? In the sense that an individual with diagnosed generalized anxiety disorder, as an example, who engages in regular physical activity over a period of 4, 5, 6 months, at the end of that intervention, may no longer have a clinical diagnosis, because the symptoms have been alleviated, lessened to such an extent that they no longer are diagnosed with clinical generalized anxiety disorder. Doesn't mean that they will never suffer from that again, but at least they have figured out through that physical activity a way that they can alleviate those symptoms to the point where they're no longer in that clinical domain. The simple answer to your question is yes. Exercise can be effective in alleviating symptoms of anxiety as well as anxiety disorders, either attenuating them, making a severe or a moderate level of a disorder less than that, right? Make it mild, or if you go from severe to moderate, that's still an improvement. I think we'll see more and more as we as we continue to investigate this, we'll see more and more evidence that this is the case. Again, not that it's a cure. I would never tell somebody, if you had come to me and were diagnosed with generalized anxiety disorder or social anxiety, whatever it might be, I would never say, oh, you need to exercise. Go exercise and you'll be fine. I still think that, there's a need for trained clinicians, whether that be a counseling or a clinical psychologist or a psychiatrist, to make sure that what you're doing is not going to be harmful. The approach that I think we have had, at least we have in the US, and maybe similar in Australia, is I use the analogy of, if I want to push a thumbtack into my bulletin board here, the easiest way to do that is with my thumb. But what we do instead, if the anxiety issue is the thumbtack, I'm going to take a sledgehammer and just pound that thing into the wall. And that's what we do with, if someone presents with mild or moderate symptoms, maybe the first course of action should be something like some kind of a lifestyle intervention, physical activity, maybe meditation, maybe something like that. And if that doesn't alleviate the symptoms or manage the symptoms enough, then take a step up to something that's a little bit more heavy-handed, I guess. And I don't mean that in a completely negative way, but then maybe we introduce cognitive behavioral therapy, some psychological treatment, or we go to the medications that have been used often as the first line of defense. And what ends up happening for most people, and I've seen numbers that would suggest that if you come to me with an anxiety disorder and I put you on medication X, you might be lucky enough to be in the 30% of the individuals who respond to that medication, or you might be the unlucky one who falls into 70% group. And of course, then what happens is, well, medication X didn't work. Let me try medication Y. Oh, that didn't work either. Let's try medication Z. Oh, we're starting to see some alleviation of symptoms, but not as much as we'd like. So let's add medication A to medication. And it's like you become this walking, talking pharmacological experiment. And I don't think that's a good approach personally. And I feel blessed that I haven't had any sorts of issues that way. But I feel for people who end up feeling like they're just bouncing from one medication to another until they maybe find the right one. But then the other part of that then is you're then reliant on medication, and you may not be lucky enough to have insurance that will cover the cost of that. Or there are other side effects of the medication that you don't like. The thing that I think is maybe one of the most powerful parts about physical activity and exercise, when that works for somebody, is I'm doing this myself. I don't need any special anything. And that's the other thing that I've really started kind of pushing when I talk about this is as a discipline anyways, kinesiology, exercise science has kind of done a disservice to the public in that we say exercise means go there to that building and use that equipment and do this class or do it. You can do exercise anywhere, right? Getting up and walking is better than not doing anything at all. We kind of have to retrain people to think about what is exercise. It can, it can be whatever you enjoy doing that involves moving your body, right? It doesn't have to be in a specific place with specific kinds of equipment or with certain instructors. Anything that you like to do that involves movement is exercise.
Yeah.
Doesn't need anything special. So it's kind of universally available. And, if I know that I'm in charge of, because I've realized it through this, self-experiment that when I'm feeling anxious, if I go for a walk or if I go do a workout of whatever flavor that makes me feel best, I'm kind of in charge of that, right? I don't have to worry about whether my prescription is running out or whether I can get to the pharmacy to get a refill before it runs out. I'm doing it myself. That's very empowering.
Yeah, I love what you're advocating for, the kind of stepped care approach, right? Where you've got different treatments to meet people at different intensities of need. And one of the beauties of exercise is the side effect profile compared to something like pharmacology, which obviously there's different medications with different side effects, but generally speaking, it's a lot more benign. The side effects are positive. Okay, you're doing it for your mental health, but you're going to get the physical health benefits, whereas pharmacology, quite the opposite.
And, one of the best kind of side effects, if you will, from being more active is the fact that active people typically have less risk for chronic disease and disability, less risk of dying prematurely. And, I use the rectangle lifestyle where, you have a certain quality of life and you want to maintain that for as long as possible. We're all going to pass along eventually, but I would rather have it be very quick as opposed to kind of the triangle life where you're kind of seeing this decline over time in quality of life. You still may live almost the same length of time, but the quality of that life isn't nearly as good as it would be if we did things like ate better foods and moved more and got proper sleep and figured out how to manage our stress a little bit better. I'm not saying exercise is the magic bullet, certainly, but you probably know you do a survey and maybe 10 to 15% of the population is engaged in sufficient levels of exercise on a regular basis. I mean, man, that's pretty abysmal. I've kind of jokingly said what we do isn't rocket science, and thank goodness, because we can't even figure out how to get people to get off the couch and stay moving for a good portion of their lives. I mean, 10%, geez, and that's if you ask people, you start measuring it with devices, and it gets even less than that. I've seen some studies say it's as little as 3% of adults are engaging in sufficient levels of activity.
Well, yeah, I read this quote. I think it might have even been in one of your papers that exercise is a best buy but a tough sell. And despite all these wonderful benefits of it, we still, like you said, are struggling to get people to do it or to adhere to it. And that's a whole issue in itself.
Right, exactly.
Yeah.
It is. Yeah.
So as well, you mentioned something about kind of health, physical health and conditions from the physical kind of realm, if you want to separate the two. But it seems like people with anxiety and indeed mental health disorders are at a higher risk of a lot of physical conditions like cardiovascular disease, type 2 diabetes. So this is compared to the general population, people with mental illnesses. So that's just another really profound reason why exercise can be so beneficial for people with anxiety disorders.
And we haven't figured out yet how to take all of those benefits and put it into a pill that people can take once a day and call it a game, right? So yeah, I mean, it is. It's a tough sell, and we haven't figured out how to crack that nut yet. We think we've kind of hit on something in terms of the way that exercise makes us feel when we're doing it, but we'll hold off on that because that may be coming in a little bit.
The affective rebound. We'll get to that. Yeah. So with exercise, let's say we're talking purely now, people who are exercising for weeks at a time, so a more chronic sense, and trying to reduce their anxiety. Are there particular variables of exercise, whether it's aerobic versus resistance, whether it's frequency per week? Are there particular variables that are better or worse for reducing anxiety?
Yeah, that's a great question. And from my reading of what's available, the general consensus I think right now is aerobic exercise seems to work to reduce anxiety symptoms. Resistance exercise, and this is based on the research, doesn't seem to work quite as effectively. In some cases, studies have shown or reported that anxiety actually increases with resistance exercise. And that always made me scratch my head because I think, I'll ask my students, I'll say, how many of you lift weights? And you see, easily probably 40% or more of the students' hands go up. And I'm thinking, well, if exercise made you feel more anxious, why would you do it? And I think what's happening, it's really just a methodological artifact in that the questionnaires that we always use to assess anxiety symptoms include things like feeling jittery or tension, which could be psychological, or you could think of that, you could interpret that as more muscular, somatic tension. So when you look at items on the questionnaires that are really dealing with more the cognitive aspects of anxiety, being worried, being frightened, those either don't change or they go down. So I think, and we've seen it with in some clinical studies, resistance exercise works as well for reducing anxiety symptoms as aerobic exercise does. And again, I think what it comes down to is what is it that the person is going to enjoy doing and that they'll keep doing. If they like lifting weights or doing some kind of resistance exercise, that's what they should do. If they like to go for a walk or a run or ride a bike, that's what they should do. If they like playing pickleball, that's what they should do, right? The other variables, frequency. I haven't seen anything other than, being regular, whether that's twice a week, 3 times a week, once a week, as long as it's regular. I haven't seen any good data that would suggest that there's a certain frequency of days per week that people should be exercising. Duration. There was a statement made, I think it was back in the 1980s, that said that to reduce anxiety, you should exercise 2 to 3 times a week at an intensity that is somewhere in the neighborhood of 60 to 80% of max for at least 20 minutes. And, wasn't really questioned. But when you look at that, what is that at the time anyways? That was exactly the exercise prescription guidelines. 2 to 3 times a week, kind of a moderate to moderate vigorous intensity for at least 20 minutes. Well, does that mean that if you don't exercise for 20 minutes, you're not going to get the effect? Does that mean if you don't get at least that kind of moderate intensity, you're not going to get the effect? Well, it turns out even going for a 5 to 10 minute walk has been shown to reduce symptoms of anxiety. And a walk, it can be brisk, but it could also be leisurely. And the same sorts of anxiety reducing effects are shown. So there, I know that for a long time, and I was part of this, there was kind of this, if you will, search for the holy grail of the optimum dosage of exercise, right? And it kind of turns out that the optimum dosage is anything that the person is going to do on a regular basis. Some people like vigorous intensity exercise. Great, do it. Other people, vigorous intensity exercise is the last thing they want to do. That would cause them anxiety to think about doing that. Well, obviously, don't do that. So, the other variables, there really isn't any, to my reading of the literature, there isn't any clear-cut evidence that a certain frequency or intensity or duration or even type is going to be more effective than anything else in reducing symptoms of anxiety. It really is a matter of what is going to work best for the individual.
Yeah, okay. I think there's a couple of things that come to mind. It feels very empowering for people to know that it's kind of horses for courses. You have control over some of those variables and you can make it work for you to get the anxiolytic effect of exercise. But at the same time, I feel like there's this perception that there must be, like you said, that magic dosage, magic type, and that's almost like embedded in the cultural kind of cultural beliefs that, there's a magic pill, and to unlock the benefits that you have to do it, in a really, really intense way in a gym. And that's the same for almost like all of mental health or psychology. We're looking for this, the holy grail, like you said, magic pills in therapy, medication, exercise now as well.
Yeah, as I said, the interesting thing about that is, I think most people automatically think, well, medication is going to work. That's kind of what we're told all the time. And yet, like I said, with anxiety, only about 30% of individuals who are prescribed an anti-anxiety medication, an anxiolytic medication, actually find relief from their anxiety symptoms from the medication with whatever is the first attempt at using it that they're using. They may get it from a different medication, but again, it's that kind of ongoing experimentation of, well, A didn't work, maybe B will work. Well, B didn't work any better than A, let's try. It's like, man, that can be very depressing and maybe even stressful for patient, for the individual who's living with those elevated symptoms. They want relief, but they're not getting it. And never mind, like you said, all the side effects that kind of typically go along with medication. You're not getting relief from your symptoms, and all these other things are starting to happen that didn't happen before, so that makes it even worse. So, yeah.
So let's jump around a little bit. You mentioned something really interesting earlier about exercise and it increasing anxiety acutely, so kind of immediately, and talked a little bit about the methodological limitations there. So can you tell us a little bit more about, why exercise might increase particular symptoms of anxiety in individuals, just so they can have a bit of an expectation if people are going to start exercising?
Sure. This kind of relates to one of the other questions that you had in the message you sent me. Some people might be very sensitive to symptoms of anxiety. So, if my heart starts to beat faster, I might think, oh my gosh, I'm having a panic attack. Or that elevated heart rate is a symptom of anxiety. Maybe my breathing becomes a little more shallow, or I might start to sweat when I get anxious, or my muscles might get tense when I'm anxious. And some of those same things happen with exercise. Obviously, heart rate is going to increase for sure, but in some of the studies that have looked at this, it's almost like exercise becomes a form of exposure therapy where you, in essence, you put the individual in a situation where those symptoms are increased, and yet they realize, well, my heart rate is elevated, but I'm not anxious. It's because I exercise. And when I'm done, you get that, in a way, it's sort of a rebound with anxiety. You get that kind of sense of calm, that relaxation, the opposite of being anxious, which unfortunately doesn't last forever, but at least it lasts for, depending on the individual and the kind of exercise. It could be anywhere from 30 to 30 minutes to maybe up to as much as 4 hours or more that they feel a relief from those symptoms that make them feel anxious. It's kind of a really, in a way, kind of a neat exposure therapy. But it also has, as we said before, the really positive collateral benefits that come along with that elevated heart rate and, the complete physiological disruption that happens when we get up off the couch and go for some kind of movement, much more so if the movement is more intense or more vigorous. But it's happening even just by getting up and walking down the hall or taking the stairs instead of walking into an elevator, or any number of different ways that we can move around, as opposed to the environmental conveniences that we have that don't make us have to move around. The super long moving walkways that they have in airports and even in other kinds of public spaces. So you just step on it and just magic. It's like a magic carpet. It just takes you on down the road. But I always kind of like to, excuse me, kind of walk alongside that moving walkway at an airport and try to keep up with the people that are on there and even go faster than they are, just so I can say, yeah, I'm staying active here.
I love it. Even to travel at airports into some exercise for your own benefit.
Hey, the stairs are always available. They're always open. Yeah. You don't have to worry about a crowd on the stairs. Yeah. And if you carry your bags, you get resistance along with it.
Yeah, there you go. Resistance training while you're traveling. Love it.
There you go.
Yeah. So in terms of the anxiety sensitivity, so that's really interesting. And I've come across this term of anxiety interpretation. So the idea being that when you exercise, like you said, you experience these physical somatic symptoms of anxiety, but in a non-threatening context, where if you're someone with generalized anxiety disorder, social anxiety disorder, typically when you feel these symptoms, it's coupled with the worries, the catastrophizing, the what if this bad thing happens. But when you exercise, you get a chance to experience those same physical symptoms, the heart rate increasing, the sweaty palms, etc. But in a, like I said, a non-threatening context of exercise in a safe, hopefully, environment. And that can transfer to anxiety in other situations where you feel the same physical symptoms, and you're learning that, okay, these physical symptoms actually don't mean the bad things are happening, and they can actually, mean other more neutral things. Do you have any thoughts on that, the anxiety interpretation?
I think you said it perfectly. I mean, I think that's the exact idea. There was some work by, I want to say the author's name was Broman Folks, where they looked at anxiety sensitivity. Not anxiety per se, but just looking at these symptoms that people who tend to be more susceptible to anxiety, either problems or even disorders, the elevated heart rate, sweaty palms, muscle tension sorts of things, having them do, it was 6 exercise bouts over a 2-week period. Some did a low intensity, some did a higher intensity. It didn't matter the intensity. They showed a reduction in that sensitivity. So again, it's exactly what you're saying. How, they didn't, at least I don't recall them specifically saying that the participants were learning how to interpret the symptoms differently, but that's kind of the logical conclusion to that, right? If I'm exposing the individual, myself, to this perturbation in my physiological state where my heart rate is elevated, or my palms are sweaty, or my muscle tension is increased, or my breathing is disrupted, but I know that that is a normal physiological change, then I maybe start reinterpreting some of those physiological sensations in other situations as, hey, this is no big deal. Nothing bad is going to happen here. And I think what happens now, before that, for that individual, is that's kind of almost like a trigger for, oh my gosh, here comes the anxiety attack, right? So it certainly is something that I think needs to be explored in more depth, and certainly one study is not the answer. We need to replicate and show that what this group of people found in their study can be replicated by other people with other individuals who have anxiety disorders. But it certainly is a reasonable idea, and something that we probably need to investigate further. I think one of the problems for why medicine is always the go-to is that we haven't been able to kind of crack the nut in terms of, the physicians often will say, well, I'm not aware of the evidence, or I don't know if there's even any evidence available. And it's like, well, how are you living in a cave? I mean, we have to figure out a way to get that evidence into the kinds of places where those healthcare providers are going to see it and be able to read it and evaluate it and see that it is actually a reasonable possibility.
So important. I mean, for this to be uptaken by the public, the people who need it the most, the people they look to for advice, like you're saying, right? The physicians, the psychologists as well. We were talking earlier, but in my 5+ years of training as a provisional psychologist in university, it wasn't spoken about once as for exercise as a possible treatment for anything.
I'm not at all surprised. It doesn't happen in medical school either, which really kind of blows me away, because even if you don't think about exercise in terms of any kind of psychological issues, the fact that med school students, at least in most cases, are given none or very, very, very minimal information about physical activity and exercise. Sure, you go to your physician. Like if I go in for a checkup, my doc might ask me if I'm exercising regularly. If I say yes, he's like, okay, great, keep it up. There's no like, what kind of exercise are you doing? But what if I said no? I think the only advice I would be given is, well, you should really try to figure out how to exercise. Well, maybe if you as my doc tell me, you really need to start doing some kind of physical activity, why don't you try XYZ? Or just there, I mean, there is some evidence that shows even like a 3 to 5 minute discussion between a healthcare provider and a patient about what they can do to be more physically active. You follow them up, what was it, 6 months later, I think it was, and they're moving. It's not a ton, but they're moving up to 30 to 40 minutes more per week than they were before they were given that brief counseling session. And they compared that, of course, to another group that just kind of did their usual care. Well, just giving them that little bit of information, because it's coming from a trusted healthcare provider, right? You're my doctor. Of course I trust you. It makes a difference.
Yeah.
But they don't feel qualified because they never got any of that training.
Yeah, exactly. I can't remember exactly the names of the studies or the authors who did this, but I was reading in the book that I came across your work, Exercise-Based Interventions for Mental Illness, another particular chapter about uptake from medical professionals. And one of the reasons that they were hypothesizing was that medical professionals and indeed psychologists don't feel competent and confident enough to speak about these things, particularly in the context of mental illness. They're aware of the broader benefits. Yes, it can be good, but beyond that, the variables, how it works, what exact advice to give is very much an uncertainty for them. So they're kind of avoiding speaking about it altogether.
Yeah, because they never get any specific training in how to do it. And that'd be like me saying, well, cognitive behavioral therapy would probably be a good thing for you. I just don't have any idea how to do that, so I'm not going to say any more than that. You maybe go see somebody who knows more about it than I do, but that doesn't really help you. It's like, okay, well, now I got to go do another thing that I don't really want to do.
Well, I'm curious then. So as a professor yourself, someone who's been teaching for decades now, how do we change that, either from a psychology student point of view or from a medical student point of view? How do we change that?
That's a great question. I think part of it is the way that I hate to use the term, but it's the way that we market what we know. We're kind of we haven't done a very good job as a field of telling the general population what they should do. We go from these prescriptions of 2 to 3 times a week at 60 to 80% of your maximum capacity. It's like, what does that mean to the average person, right? They don't know what 60 to 80% is. Then we kind of changed it. And, the more recent one was, let's just tell people they need to move more and sit less. Okay, that's a simple message, but it's really hard because there's so much in our environment that's constantly pulling us to do things that we find pleasurable, but don't involve physical activity, right? It's a lot more fun for most people to sit on the couch and watch Netflix or stream something on Amazon or whatever it might be, or go to a football, and I mean that in the world sense of football, soccer.
Yeah.
Go to a soccer match and sit in the stands and watch. The whatever 20 or so people that are down on the field working, doing all the extra, but you're just sitting back and watching it, right? The other side of that then is, well, how do we get the healthcare professionals to be aware of it? And, you think about the amount of information that a medical student or someone in a clinical psych program or a counseling psych program needs to know just to be able to get through that program and become a practicing psychologist. How are you going to then add what would probably be at least an entire semester's worth of coursework into how do we do this counseling for exercise, and why should we? What's the evidence for why we should be doing this? When should we use it versus when should we immediately go to medication? Because I think there are cases where, severe mental illness, maybe the first step is the best first step is medication. I mean, it might be life-saving in many ways, but when might we say from our initial diagnosis, you know what? This person is certainly dealing with some significant anxiety issues or depression issues or whatever it might be. But before we immediately go to the pharmacotherapy or the psychological treatments, let's try some lifestyle intervention. Let's see if we can get some of this to take care of itself by showing them how they can move more themselves and see if that doesn't help alleviate the problem. And even if it doesn't manage the problem effectively enough, maybe because they're now doing some physical activity, the dosage of the medication doesn't have to be quite as severe, or the psychological treatment may work better than it would if we didn't do that lifestyle intervention first. So it's I don't know. I mean, trying to change something that's already, kind of a moving machine is really difficult, short of, just this amazing amount of evidence that says if you're not doing this, you're really screwing up your patients in a way that is just not ethical. And unfortunately, even though I think there's some really solid evidence for the benefits of exercise for mental health, it's not cracking through that kind of the wall that, the medical field has set up around it, where medication, it's like the blood-brain barrier, right? Medication gets through, it's permeable to medication, the psychological treatments get through, but exercise gets stopped at the gates.
Oh, geez, yeah.
For the most part. Not always, but for the most part.
Yeah. Well, it's interesting. I'm seeing, at least here in Australia, not from a university point of view, but more from the national bodies representing psychiatrists and GPs here in Australia, at least purport the use of things like social prescribing, which is generally lifestyle interventions, including exercise, but nutrition, sleep, and encouraging GPs or physicians in primary care to use more of that and less of medication where possible with patients. So I think that's positive. And another thing I'm seeing is not with anxiety, but I know like the clinical practice guidelines for I think GPs and or psychiatrists here in Australia the national bodies are recommending exercise as an adjunct with medication. So that's kind of speaking to what you're talking about. So yeah, again, the university level, my personal experience is there was none exercise as a treatment for us psychology students, but at least with primary care physicians here, there seems to be some very slow traction in exercise crossing that blood-brain barrier.
Yeah, well, I would say that from my perspective, places like Australia, I think we're seeing it a little bit in kind of Great Britain and the UK. We're starting to see more of what you just described. The US hasn't gotten there yet. It's still the medical model where medication is first and foremost, and we'll maybe try that other stuff if nothing else seems to work. We want to fix our problems fast and easy. And that's either going to be surgery or it's going to be medication. And if it's going to involve me doing something besides just popping a pill, I don't know if I want to do that. But again, that's the way that, at least in the US, from my perspective, that's the way that we have kind of been indoctrinated in the way that the medical system works, right? And I've made it very clear when I go in to see my primary care physician, I don't like being on any kind of medication. There are things that, there's at least one that I take on a regular basis because I have to, but I don't like it. And if there was a way for me not to have to take it, I wouldn't. And he knows that. So, he's not always going to be pushing medication as a first option. But, I think about, my parents, for example, who are well on in their years. My mom had some health issues over the past summer, and I went with her to one of her doctor's appointments, and she was on like 11 or 12 different medications at the same time for a variety of different things. And I'm just like, man, how does anybody know when you have that kind of a cocktail of medication, how they're interacting with each other? And I pray that I never get to be in that situation.
Jeez. Yeah. Polypharmacy.
But that's not unique, right? That's not a unique situation. That happens a lot.
Yeah. And I think you were mentioning as well maybe the influence of big pharma, particularly in America, because I think there's a stronger influence there than perhaps in places like Australia.
I think you're right. Yeah. And again, I don't want to give the impression that I don't think medication has any value at all. Of course it does. But it not probably. I think we are over-medicated rather than under-medicated. And of course, they're making advances in these different medicines that are better than they were, and they're getting better all the time. But, there may be, and I think there is, with exercise and physical activity, lifestyle intervention, there may be a way to circumvent having to even go there, or at least delay the going to the medication, as opposed to just going right to medication as the solution to everything.
Hello everyone, a quick break from today's episode. At the Mental Wellbeing College, we are committed to the goal of communicating evidence-based wellbeing strategies out to the broader community. The goal of this podcast is to bridge a gap between self-help material and peer-reviewed research by providing evidence-based discussion that respects the nuances of psychology but is digestible for all audiences. Ultimately, I hope that you as a listener feel empowered after each episode so that you can take away and implement strategies to improve your own mental well-being. If you have gained value from this episode of the Mental Wellbeing College, I would be so grateful if you were to hit subscribe or follow, or to share this episode with someone that you love. This is how we continue to grow the show, get the message out, and to impact people in need by providing such information and strategies. Thanks so much for tuning in. It means a lot to us here at the Mental Wellbeing College. And now back to today's episode.
My interpretation of mechanisms of why exercise is so beneficial for a number of mental disorders, mental health issues, such as anxiety, is that it's a little bit murky. We have all these hypothesized mechanisms, and the reality is probably different things. Well, exercise works for different reasons for different people, but are there other mechanisms other than the anxiety sensitivity and interpretation that you think are notable?
There's a lot of them, and you're right, it's murky. So when we really started kind of diving into, we had established the relationship between exercise and anxiety reduction. Then the question is, well, why does that happen, right? So there were a bunch of different ideas that were popular at various times and have kind of waxed and waned over the years. But one of them was endorphins, right? So when you experience a stressor of a sufficient level, your body releases endorphins. Endorphins are essentially endogenous morphine painkillers. They make you feel better. There was a bunch of research in the 1980s and early 90s trying to examine that endorphin hypothesis. And the bottom line ended up being that for every study that suggested that endorphins could explain the anxiety reduction, there was a study that would say, no way, it's not possible. That can't be the reason. It wasn't until, I think it was 2008, that we were finally able to, with technology, look within the brain itself in intact humans at the receptors in the brain itself for essentially endorphins or opioids, endogenous, so naturally occurring opioids, that would show that showed that with exercise, those receptors were activated, meaning that the opioids had kind of locked into the receptor and were exerting whatever effects they might have. And they were most likely seen in regions of the brain that are associated with emotional responding. That was kind of like, ooh, that's really cool. The catch was the study was using individuals who had gone on a run for 2 hours. Well, most of us are not going to exercise for 2 hours. And that was in 2008. I'm not sure if there have been any studies that have replicated that finding. There is some work with high-intensity interval exercise that showed a similar effect. But then, the other part of it that makes it murky is even if endorphins are elevated, it may not be associated with the reduction in anxiety. So does that mean that the endorphins didn't cause the anxiety reduction? Maybe, maybe not. Maybe there was some other psychological effect that was associated with the endorphin increase that mediated or moderated the reduction in anxiety, but we didn't measure it, so we don't know. So that was one, which is still kind of up in the air. We don't know for sure, yes or no. Not that long ago, then, some folks started looking at what are called endocannabinoids, which is another endogenous, naturally occurring, and as you might guess from the name, it's a cannabis-like substance that our body secretes, our brain and body secrete, and that has been shown to be kind of dose-related to the intensity of physical activity. And there have been some studies that have shown in people exercising that their endocannabinoid levels are increased and things like psychological tension and depression are decreased. So maybe that's the reason. Okay, great. Maybe it is. That's still a fairly new player in the whole mechanism game, and it requires, I think, much more systematic study before we can say for sure it is or isn't or might be one of the reasons why. There's the classic study from 1978 with Mike Barkey and Bill Morgan that showed that they took 75 people, randomly assigned them to either walking on a treadmill for 20 minutes, sitting in a quiet room in a lazy boy recliner for 20 minutes, or doing essentially non-cultic meditation for 20 minutes. All three groups showed a significant reduction in anxiety. What's the same thing for all three? Well, it's time. So maybe it isn't a physiological thing at all. Maybe it's just the kind of the passage of time, or doing something, reading, meditating, exercising, that is a time out from the usual stressors that we have on a daily basis. Well, if we step away from those for a little while, we feel less anxious. without spending 2 hours going into all the various mechanisms, my sense is it's likely a combination of physiological, psychological, even social factors that lead to these changes. And as you said, it could be that the mechanism that works best for me is a little bit different than what works best for you or for somebody else. You might say, well, who cares why exercise alleviates anxiety? It just does. And that's a fair point. But of course, as scientists, we kind of want to know, well, why does that happen? So we continue to try and explore these different ideas to see if we can't figure out what is it about exercise that leads to this outcome. What's inside the black box that's causing that to happen? And we don't have the answer yet, but there's plenty of investigators who are trying to pinpoint what that might be, or maybe even better, maybe eliminating some of the possibilities that can't be the reason. We haven't really done a very good job with that yet either, but we're at least working on trying to identify what does work potentially and identify what doesn't work. Eliminate that from the possibility.
It's really interesting to hear that it is quite murky. There are all these hypothesized biological, psychological mechanisms. And my sense of it is that this might actually be one of the reasons why it's not taught as much or at all, for example, to students, is that there's a preference for having black and white and clarity, and that even without any more evidence showing the efficacy or effectiveness of exercise, if we just had more on the mechanisms, rightly or wrongly, this would be taught more at universities if we just had more answers.
Yeah, well, here's the rub. Doing that kind of research is hard. It takes time. Yeah. It's really easy to recruit however many people and have them complete an anxiety measure, then do a bout of 20 or 30 minutes of exercise and complete another anxiety measure and call it a day, than it is to get those same people and collect either, some physiological measures, whether it's through saliva or blood, or maybe measuring brain activity or hormonal changes, whether we're measuring catecholamines or some other endorphins or whatever it might be, and doing that over the course of an exercise bout, or maybe even over the course of a 4 to 6 month intervention. That's hard and time consuming and expensive. But you're right. If we could show that the reason that exercise makes people feel less anxious is because it releases X, and X causes Y to change, which ultimately makes me feel more relaxed and less anxious. That'd be great. One of the possible mechanisms is elevated body temperature. It's in the literature, it either goes by the hyperthermic model or thermogenic hypothesis. And the idea is basically this. When you exercise, you increase body temperature. You increase the temperature of your body, right? It's that elevated temperature that leads to, following the exercise, muscle tension reduction. So muscle feels more relaxed, and that interpretation of that relaxed musculature is psychological relaxation or a reduction in anxiety or stress. So it's kind of a two-pronged change, right? It's the elevated temperature that leads to the post-exercise muscle relaxation, which then we interpret, whether consciously or not, we interpret that as being more relaxed or less anxious. That's a pretty consistent finding, even though it isn't really examined much today. This goes way back now, back in the 60s and 70s and 80s, there was a lot of research looking at that. And it isn't just at the muscle level, it's even at the neural level. So there's kind of less, it's almost like a dimmer switch, right? When you elevate temperature, it turns down the lights. So there's less electrical activity going out to the muscle, which makes the muscle more relaxed, and you feel more relaxed then. And I'm not saying that's the answer either, but that's a mechanism that's been explored and has been shown to consistently work in that particular fashion. Why we still aren't looking at that as much as we probably should be, I don't know the answer to. I think the biggest reason why we don't see more of that is when you do a study like that and it isn't nice and clean cut, people get frustrated and they say, well, why are we wasting our time doing all this sophisticated, time-consuming measurement when we can just give them a questionnaire and ask them and not worry about why it happens? We just want to know that it does happen. But to your point, if we could show why, then it might be that we might be making better inroads with the healthcare field, with prescribing exercise more than we currently do.
Yeah, sounds like what we need is a billionaire benefactor for the exercise for mental health research industry to fund all these studies. Yeah.
There you go. That would be great, wouldn't it?
Well, you mentioned a couple of things there. So endorphins, the endogenous opioids, endogenous cannabinoids like anandamide. So this brings to mind affect or mood and feelings of feeling good during exercise. And amongst general, say, lay populations, the general consensus is that when you exercise, you feel good, you release all these feel-good, hormones, like you kind of alluded to. You get this runner's high if you're running, for example. But your research shows that it's a little less clear-cut than that. So talk to us about affect during exercise and indeed the term you've coined, affective rebound.
Yeah. When I started this journey a million years ago, it was pretty much the standard in kind of exercise psychology. You basically studied the anxiety-reducing effect, the anxiolytic effect of exercise, right? So we would ask people how they felt before. We'd ask them how they felt after. We assumed that if they felt more anxious before than they did after, that something about the exercise made them feel less anxious. Well, I had a grad student, Patty Akakakis, who came to work with me in the late 90s, and he had this radical idea. First, he said, why are we only studying anxiety, right? What if I'm not anxious? And, point of fact, most of the work that I did in the anxiety domain, my own research, you look at people pre-exercise and they would get a score of, let's say, 16 on the anxiety measure that we were using. The scale went from 10 to 40. So they're almost at the bottom of the scale already. They are very low anxious to begin with. The fact that we actually showed that they got a little bit less anxious with exercise was somewhat remarkable. Patty's idea was there might be something besides anxiety that people feel. And oh, by the way, haven't done anything to look at what's happening. What are people feeling during exercise? And maybe it doesn't matter, but we've never looked at it, right? So we started, in the initial studies, we would include measures of anxiety just to kind of try to replicate what we'd done before. But we started looking at other measures of affect, how people feel. And what we came to find was, as the intensity of exercise increased, people felt progressively less pleasant, and at some point would even start to feel unpleasant during the exercise. So what? There's some, there's some really interesting research that was done. As far as I know, the initial study was done by a guy named Dave Williams in 2008 that showed that how people felt while they were walking on a treadmill, how they felt during that exercise was predictive of whether they were continuing to exercise 6 and 12 months later. And he showed that, and we use what's called the feeling scale, which is simply how do you feel right now from very good to very bad. He showed that a 1 unit change on the feeling scale. So if I go from a 2 to a 3 or a 3 to a 2, if I go 2 to a 3, I'm going to be exercising 30 to 40 minutes more in 6 and 12 months than if I were to go the opposite direction. And it started making us think, well, shoot, how people feel while they're engaged in the activity might be really important. And in a way, you kind of sit back and you think, well, duh, of course it matters. If you and I were having this conversation right now, and maybe it'll happen to some of the folks that tune in when you post it, but if I start listening to this, I'm just like, oh, this is awful. Why am I listening to this? Why would you keep doing it, right? If there wasn't some other reason for doing it. So if I'm doing, and I'm going to use the example because it's kind of, I think, still the rage, high intensity interval exercise, right? So I'm told, because it's everywhere, that if I do 10 1-minute bouts of super high intensity exercise, and after each 1 minute, I do a minute of nothing or very low intensity, I'm going to get in the best shape of my life. Well, the problem with that is, while I'm doing that 1 minute of super high intensity exercise, I feel awful. And I feel awful the first minute and the second minute and the third and I actually feel even worse as you start to add all those minutes together. Why would I do that? Right? If I go for a 15-minute run, even if it's at kind of a moderate intensity and I feel terrible when I'm doing it, unless I have some prior experience or there is some other reason why I'm going to keep doing that, I don't feel good doing it, I'm not going to do it. I mean, that's just kind of like common sense, right? And, we've known this for a long time. How people feel when they're engaged in an activity predicts whether they're going to do it again. Duh. If it feels good, I'm going to do it again. If it feels bad, I'm not. So how we feel during turns out to be super important in terms of whether we continue doing it. You mentioned affective rebound. So what happens is, once regardless of what's going on during, if you're doing that high intensity, for example, or vigorous exercise, and you're feeling progressively less and less pleasant, as soon as you stop, you bounce back and you feel much better. Well, again, is that just like, oh, thank God that's over? It's kind of a relief. Probably, especially if it's high intensity. But that rebound might be linked with some really important physiological changes that are occurring. We haven't really explored that quite as much as we probably need to, but with the studies we've done, if you ask people how they feel right at the end of a bout of exercise, and then you ask them again 1 minute later, it's completely opposite. So if I felt really bad at the end of a really high intensity exercise bout, a minute later, I'm going to feel really good. That might happen in the first 5, 10, 15 seconds. We don't know because we haven't measured it that quickly. But intensity matters. And it's the ventilatory threshold. So the point at which the intensity of the exercise gets to the place where you start producing more lactic acid than your body can kind of remetabolize, it starts accumulating. That's when that feeling state starts to switch from pleasant or neutral to starting to become unpleasant and uncomfortable. And if you keep increasing the intensity, that keeps getting worse and worse. So we know that intensity matters. It's obviously going to be person dependent, because someone who's more fit and regularly exercising likely has a higher ventilatory threshold, a higher point at which that accumulation starts to occur than someone who's completely deconditioned. But we know that that's really important for how people feel. And we know from not just the one study by Williams, but several now, how we feel during is really the most important predictor of whether we're going to continue it long term. Yes, if I enjoyed it after the fact, if I think back and say, you know what, it felt awful, but man, it was so good, right? I enjoyed that so much. Maybe because, and we may get to this, if I prefer high intensity, I may not like it when I'm doing it, when I'm in the middle of it, right? But when it's over with, it's like, yeah, I'm really glad I did that. It felt bad, but I'm so glad that I did it. I really enjoyed it. I can't wait to do my next one, right? Whereas somebody else may be, man, that is the last thing I ever want to do again the rest of my life, because that felt miserable. That was the most awful thing I've ever experienced. Maybe that's our 90% of the population problem, right? Everybody does the same thing. Everybody takes goes to an exercise class, or even kids in a PE class. Everybody's going to do, I don't know if they do this in Australia, everybody's going to do the PACER test, which is a way of measuring fitness, right? I ask students today, they're college students, they remember when they were in grade school doing that. You can just see their faces kind of curl up like, oh, that was awful. So those memories are really important too, right? How we remember feeling doing that certain activity could be a deterrent or a facilitator for continuing to take that up again in the future.
Okay, so there's a ton I want to unpack there. The first thing is this ventilatory threshold. It just took me, I'm still trying to get it around in my head. Are there signs that people can look out for when they're exercising of, okay, I am getting close to that threshold? Because I think that's important, given that's kind of the turning point, as you guys term it, when intensity can really affect with E-F-F-E-C-T, affect mood and feelings, affect, yeah. So can you unpack the ventilatory threshold?
Yeah, so one of the techniques that was and maybe still is, that gets talked about in terms of intensity is they call it the talk test, right? If you can exercise and carry on a conversation, then the intensity is probably more moderate, light to moderate. When you get to a point where you can't carry on a conversation without, pausing or gasping, etc., then the intensity is getting up above, around and above that ventilatory threshold. We have shown that, forget about the talk test, because what if you like to exercise by yourself? You're not going to talk to you could, but base it on how you feel, right? Because again, we know that when we exceed that point, we're changing our internal environment in a negative direction. It leads to negative feelings. We use those feelings as your guide, right? So when you're exercising and it starts to feel uncomfortable or unpleasant or even aversive, back off a little bit and see if that doesn't alleviate some of that uncomfortableness, and just go with what it feels like. I know it sounds kind of weird, but using our feelings as a guide is pretty effective. And there have been some studies that have done that, where they'll tell people exercise at, I'll say intensity. I don't know if that often resonates with the layperson, but exercise at a level that you feel good. And you can show them the scale. You can just tell them, exercise at a level that feels good. And if it starts to feel less than that, then back off a little bit. Or if you need to go at a little bit harder to feel good, then go ahead and do that. And those studies have shown that it really is effective at keeping people with that physical activity more long term. There's been a couple of really cool studies too, where they have looked at either ramping the intensity up during an exercise bout. So you kind of like most people do, I think you start out with a kind of a light warm up, and then you gradually just increase the intensity over the course of the workout, versus after a warm up, starting at a high intensity and gradually coming down. Well, I think it's pretty obvious. As you decrease the intensity during the workout, people will remember that as being more pleasurable and will be more likely to want to do it again than if you're increasing the intensity over the course of the workout, which they will remember as being more unpleasant. Because again, it's how they feel at the end. In the one case, they feel progressively better. In the other case, they're feeling progressively worse. And if I remember the end of that exercise as being, man, that was awful, or man, I felt really good at the end of that, it seems pretty obvious which one is the more likely one that the person is going to want to do again. And in fact, I think there's another study that looked at kind of a pyramid, where what I think most people do, right? They warm up, gradually increase the intensity, and then at some point start to decrease it during the same workout. And I wish I could remember the specifics on how that ended up, but I think that ends up being kind of the best of both worlds, because you get the increased intensity, but you finish in a way that feels more pleasant, meaning you're more likely to remember that as pleasant and more likely to do it again going forward.
Tell me if I'm oversimplifying this, but the more intense the exercise, the worse you generally tend to feel during the exercise. But there are obviously the rare people, I'm certainly not one of them, the unicorns among us who, swear by, their really intense CrossFit workouts or their, high intensity interval training, whatever, right? Are they lying, or are they the exception to the rule? What's going on there for people who really love in the moment and say, no, when it's the hardest, the most intense, that's where it's at for me. That's what I love.
Yeah. Well, they're certainly not the majority. But, there are people who, for whatever reason, they have a preference for more intense exercise, and they can tolerate that higher intensity better. So at the same absolute intensity, the person who has a higher tolerance doesn't feel as unpleasant as the person who has less tolerance for that higher intensity. When we first started looking at this, we would look at that in terms of extroversion, right? The extrovert is somebody who seeks out stimulation to feel good, right? To kind of feel more optimal. The introvert, and depending on how well you want to believe the ideas of Hans Eysenck, the introvert has a lot of stimulation already at rest. They're already on their high caffeine dose, right? So they try to avoid additional stimulation because that's uncomfortable and unpleasant. So the extrovert, which in the research that we did developing this preference and tolerance measure, the extroversion measure itself doesn't really predict that response the way that we expected it to. And the thinking, and again, I'm going to give Patty the credit for this, the thinking is most of the extroversion personality measures of extroversion really focus on social kinds of stimuli, being in a group, being in, listening to loud music or being around a lot of people, etc. But it doesn't really get at internal sensations. So the way that we develop the measure gets more at those what we call interoceptive, internal sensations, the elevation in heart rate, or the knowing, feeling that sensation of your breathing changing, or maybe that your muscles are getting more tight, or you're sweating, or whatever. And when we looked at it from that perspective, and those preference and tolerance measures they're associated with extroversion, so they're variants of extroversion, focus more internally. Those are associated with these changes. So people who prefer higher intensity will feel better and or less bad at a higher intensity than somebody who has a lower preference. Likewise, people who have a higher tolerance will feel better and or less bad than somebody who has a lower tolerance. And we've looked at that in terms of behavior. If I have a higher tolerance, I will stick with a high intensity session longer than someone who has a lower tolerance. Given an option to quit whenever, well, if I don't like this, if I'm feeling awful because this is a higher level of intensity than I'm willing to tolerate, well, then I'm going to quit sooner. As would be expected, someone who's more extroverted would stick with a more intense session longer because they can tolerate pain better, and it's more stimulating to them. This is part of the thing that I love, but also makes the work so much more complicated. You and I are different people. I shouldn't expect that you and I are going to respond exactly the same way to the same exercise stimulus, right? You grew up in a completely different environment than I did. You grew up in a completely different time frame than I did. I'm going to guess on that. Your hair's not as gray as mine. You've got a completely different set of experiences. Your genetics are different from mine. Everything is potentially different. So it's somewhat silly to think that everybody's going to respond the same way, even in the work that I just talked about, where we know that as intensity goes up, people generally feel worse, right? As it's linked with intensity. The more intense, the worse they feel. But there are still some people, even at high intensities, who feel good. And there are some people at low intensities that feel bad. So there's individual differences in there that I think that's really kind of super fascinating. And we've just barely kind of scratched the surface on understanding those individual differences.
You talk about and measure exercise intensity tolerance as a trait, and you were talking about different personality traits there. But how much of that is explained by just being more fit? Where if you are more fit, you develop a greater tolerance to high intensities of exercise?
There's certainly part of that. There should also be some genetic influence there. And we had posited that when we developed the measure, and it wasn't until, excuse me, I think it was, 2018, 2019 was the first study that showed that there actually is a genetic influence on tolerance. So, there is a genetic link to that. And that's a whole different area that, we don't have time to get into, and we haven't done a very good job of looking at yet. But the genetic influence on all of this, right? On how you respond to the same bout of exercise as I did, that the same bout of exercise gives you a different response than it does me, or gives somebody. There's going to be a genetic component to that, which we have barely started to look at. And I think that's going to be really a fascinating avenue going forward, not just for explaining, various physiological outcomes, but how it's linked with personality or individual differences like preferences or tolerances. How is it linked with how people feel during and after those exercise bouts? And how does regular exercise, so to your point there, if I start doing this and I stick with it and I get more fit, does that change my preference? Does it change my tolerance? And I think the data that's available suggests yes. So not only is this individual difference of preference or tolerance or extroversion or introversion, is it kind of an antecedent, right? It isn't necessarily just predictive of what you're going to do, but engaging in physical activity can actually modify that to some extent, maybe more in some people than others. But there's, I think, a pretty decent body of literature that has shown, excuse me, that has shown that exercise can change aspects of personality. People that stick with an exercise program become more conscientious, a little bit, not a ton. They become more emotionally stable. They might actually become somewhat more extroverted or somewhat less introverted. Now, again, I'm not going to say that exercise changes your personality. So you go from a type A to a type B, but it can modify some of that. Just like there's actually a thing called the maladaptive personality trajectory, where sedentariness, so lack of activity, can actually increase emotionality or neuroticism and decrease extroversion and conscientiousness, which is linked with elevated risk for morbidity and mortality, chronic disease, chronic illness, and premature death. So it's kind of an interesting, everything's kind of tied together. It's not like we can just say, okay, we're just going to study this and pull it out and study it like in a petri dish, because there's so many other factors that are influencing all of this. In a way, it's sort of amazing that we've even come to some sort of consensus about how exercise influences psychological factors, given all the complexities that surround what we're doing. Even if it's just from the standpoint of each person is different in some or maybe many different ways. And the fact that we can still see this change sort of consistently is rather kind of amazing.
Yeah, I had no idea in that research that it could influence your, 5-factor model personality traits, for example. So that's, extremely intriguing. And your work on exercise in intensities, it seems like it would have big implications for adherence, which is a theme that we've been talking about a lot about.
Right.
And particularly if you're either a psychologist, a doctor prescribing exercise for more mental health benefits, or you're an exercise physiologist or a personal trainer prescribing it for more the physiological benefits. But that considering these individual differences in preferences and tolerance for intensity should be something that's really considered, but typically I think isn't. At least maybe it is more in disease populations in terms of risk for safety, but if you're trying to improve your cardiorespiratory fitness or put on muscle, typically the kind of theme is the more intense, the better. But your research kind of stands in stark contrast to that. So it seems like it has really strong implications in that aspect.
Well, in some ways, yes, right? The more intense, the better, but not for everybody. And really, to your point, I think if the exercise itself is more intense, it's generally for most people going to feel less pleasant. And because it feels less pleasant when they're doing it, they're less likely to do it consistently. So adherence is not going to be very good. Unfortunately, adherence studies, and this is something I might get myself in trouble with some of my colleagues for, but we've been studying various kinds of ways to increase exercise adherence for decades. Millions of federal funding dollars have gone into this question, right? And what has happened? I'm basically going to make a maybe sounds kind of outlandish, but basically we haven't moved the needle, right? People are no more active today than they were when we started doing this. And I think the problem has been we have focused almost exclusively on trying to show people why it's good, give them rational explanations for why being physically active is good for you. But we're kind of fundamentally irrational people, right? We want to do things that make us feel good. We avoid things that make us feel bad. That's somewhat of an oversimplification, but we haven't really figured out how to put the focus on that part of the exercise experience, right? What is it about exercise? How can we set exercise up to make us feel at least not unpleasant, if not at best, to make us feel good while we're doing it? Because if it feels good, we're more likely going to do it and we're going to keep doing it, versus if it doesn't, we'll find all kinds of reasons not to do it. Everybody knows smoking is bad for them, but lots of people smoke. Everybody knows that, eating a high fat, low nutritious diet is not going to be very good for them, but people do it, right? So trying to focus on just cognitive parts of this, the rational mind, hasn't worked. And, big surprise, we are not completely rational beings. We do things because they feel good. Even if we know from a rational perspective, that cheeseburger isn't going to be very good for me in the long run, but man, it sure sounds like a really good thing to have right now. So that's what I'm going to have. It's a road. We still have work to do to try and figure out how to take what we've learned and use it in behavioral change interventions so that we can get away from focusing just on kind of rational reasons for why we should or shouldn't, and incorporate those feeling states. Let me just share one really interesting study. These things, smartphones are ubiquitous, right? Everybody's got one, or almost everybody has one. There's a colleague of mine at Penn State named Dave Conroy who did a study where they took cell phones. They had to use like an Android because Apple wouldn't let them use the home screen. But every time you pick up your phone, your home screen comes on, right? And what they did very cleverly was they paired on that home screen, the lock screen of the phone, they paired an image of somebody doing physical activity with another image that was something pleasant. So the one that I like to show my students is the golden retriever jumping up in the air to grab a Frisbee. So you've got these two images that you see every time you look at your lock screen. And they weren't the same every time, but they paired these. Well, the people that got over, I think it was like, I don't remember how many weeks it was, but over the course of that intervention, which was relatively brief, they followed them then over the next 8 weeks. And the ones who got those pairings of pleasant images with physical activity increased their physical activity over those 8 weeks. There was nothing overtly said. It was simply every time you look at your lock screen, you saw these pairs. And those who got that pairing of activity with pleasantness increased their activity. Kind of a clever way of changing behavior without actually, with the person not even really knowing that you're trying to change their behavior.
Yeah, just a little behavioral nudge. Yeah.
Yeah, exactly.
Yeah. I had a gym for a few years and was a personal trainer for quite some years. And the reason I bring that up is I got a chance to, I suppose, have my ear to the pulse, or finger on the pulse rather, with general population of people just wanting to get fitter, lose a bit of weight. And the strong consensus that I have on this is that people knew the benefits of exercise, and the reason they were struggling to exercise and why they signed up to the gym or to personal training was really to help with the adherence side of things. It wasn't for someone to educate them on the benefits they'd known for years, yet struggled to make it habitual. And this refers to, I think, the revolving door phenomenon where people start but can't maintain exercise. And obviously it's a huge, huge problem. And I think this really brings to mind as well something called the G.I. Joe fallacy. I don't know if you're familiar with G.I. Joe, the TV show in the 80s.
Yeah.
Before my time. But so apparently they used to end each episode with "now you know, and knowing is half the battle." Is that true?
I don't recall that, but it certainly sounds like something that was probably the case. But you're right? It's like I could walk across campus when the campus is busy, and I could ask every person that I stop, is exercise good for you? I'm going to be conservative and say 99 out of 100 are going to say, of course, exercise is good for you. And of course, then the follow-up is, do you exercise? And, maybe 25 of that 100 are going to say, oh, yeah. Now, on a college campus, it might be more than that. Let's even say 50% on a college campus. Well, why are the other 50%, even though they know it's good for them, why aren't they doing it? Just because you know doesn't automatically translate, which is your point, right? So creating those associations of being active and feeling good is really potentially, I'm not saying this is going to be the solution, but it certainly has a lot of utility for potentially changing at least some, if not a lot of people's behavior when it comes to physical activity.
Yeah, and if exercise is analogous to a pill, it feels like we've been putting all our attention on how do we make a more effective, stronger pill to, have the effects we want to, whereas really we should be focusing more, comparatively at least, on how do we make this pill more digestible so people take it in the first place. And, that's essentially what you've been doing, is looking at how to make it more enjoyable in the moment.
Exactly.
Is there anything finally that you wanted to convey to listeners, to students tuning in? Any final parting words of wisdom?
Well, if I could kind of boil it all down into just kind of a capsule, I think what people need to try to figure out is what kind of activity they enjoy doing. And again, for some people, it's going to be, high intensity, CrossFit, whatever. And for some people, it's going to be going for a walk in the woods or riding a bike. And, I kind of think, even if that means going to a local park and getting on a swing and swinging back and forth for 10 minutes. Whatever kind of movement they find makes them feel good, they should be doing it, because I'm kind of seeing more and more evidence that it doesn't really matter what the exercise, what the activity is. Anything is better than nothing. And especially when it comes to mental health, doing something, even if it isn't going to move the needle very much in your overall fitness, doing something is far better than doing nothing. I just feel like we have a body that is designed for movement, right? We have muscles and ligaments and tendons and joints and all this. These bodies weren't meant for sitting in chairs, looking at screens. Even though that we certainly have that. That's part of that's just an inescapable part of life anymore. But getting up from these chairs and going for a walk, and when you have the option, taking stairs instead of an elevator or an escalator. And if you don't have access to equipment, you have the equipment right here. This is your own natural equipment. Push-ups, right? I call push-ups bench pressing the world. Walking upstairs is basically doing like single leg squats, right? You're lifting your body weight up a flight of stairs. Just find something that you like to do and do it. And it doesn't have to stay the same. I swam for years. I haven't been in a pool. I can't remember when. I used to run. I don't run anymore, but I still stay active with something else that I find enjoyable. So, it isn't just for increasing fitness, increasing our physical health, increasing our physiological health, because I'm a firm believer that mind and body are inseparable. And if you take care of one, you're taking care of the other, and vice versa. Movement is medicine. Sure, movement is medicine, but movement is just life, right? I think we need to move to be healthy, to be happy, and we just have to figure out individually what it is that we enjoy doing the most. And, I would challenge anybody that would say, well, I just don't like exercise at all. There's something that you can find that you will enjoy doing. So just find it, just do something, try everything until you find the one that works the best for you.
Yeah, in a conversation that has been steeped in, complexity, we've talked about some of the doubts and skepticisms, as well as some of the technical components. That's a really profound, simple, but not, oversimplification message. And I think one that people can readily take home and use. So thank you for sharing that, Steve.
Thanks so much for tuning in to today's episode of the Mental Wellbeing College. If you've made it this far, it means you've gleaned a ton of value from today's episode, or you've fallen asleep. I sincerely hope that it's the former, and if it is, I would be so grateful if you were to hit subscribe, follow, or to share this podcast with someone you care about. Our mission here at the Mental Wellbeing College is to provide a free and accessible resource for people to take action and implement to improve their own mental wellbeing. And you subscribing, following, and/or sharing helps us to achieve that mission and to impact people in need. Thanks so much for tuning in. It means a lot. We'll see you next week on the Mental Wellbeing College.